Good morning, everybody. I'm Dr. Sugandha Gupta, consultant psychiatrist and founder director, Delhi Mind Clinic, Karolba. Today we are going to talk about an important topic, geriatric or late life depression. Why important? Well, for one, the proportion of the elderly in our country has been increasing steadily with the improved healthcare. And number two, depression in the elderly has a greater impact on the society at large, the family, and obviously their own physical health and the mental well-being, which can have grave consequences or decrease the functioning of the entire family or the person himself, even complicating the pre-existing physical illnesses. Hence, it's important that we know how to identify depression in elderly, how to treat them, and how to take better care of them. So, what are the causes of late life depression? Well, some of them are common to any age group. There are certain neurochemical changes, the role of the psychosocial factors, and everything else. Howsoever, there are some things that are particularly limited to this age group. There is, as we grow older, there is a pruning of the synapses. This leads to an increased risk of depression without going into much details. Amongst the psychosocial factors, this age group struggles with some very specific points. 1. Loneliness. Loss of a life partner, the children in the family being busy with their own life routines and days. Number 2, feeling a lack of autonomy, inability to go out, inability to meet friends, inability to go to work, whether that is because of an existing physical illness or their changing roles in the family and society, definitely leads to an increased risk of depression. Then psychological abuse, physical abuse, emotional abuse of the elderly is also increasing in our country day by day. In a country like India, where the elderly have been treated with respect for centuries, this is now rather becoming the norm. Additionally, their own worries about physical well-being, of contributing something to the family or society in the later ages of life, and then the worries about being financially dependent upon their family members or their children. All these lead to increased risk of depression. Lastly, another thing that has been changing for our elderly in the past few years is that they are loaded with the responsibilities of taking care of their grandchildren as their own sons and daughters go out to work. Even though they feel incapable or inept, they have to partake in the responsibility, or else they feel guilty or they feel scared of being called selfish or self-centered. This leads to increased depression and anxiety in our elderly. So what are the symptoms of depression in elderly? Well, for one, they are the same as anybody else. Sadness of mood, pessimistic thoughts, lack of pleasure, lack of interest, feeling tired, keeping quiet, staying in their own room, so on. There are some things which are more common in this age group. 1. Feeling irritable. 2. Feeling confused, lost, becoming more forgetful. Then unexplained symptoms. Body aches, headaches, for which no physical cause is found. Biological symptoms such as sleeping too much, sleeping too little, unexplained weight gain, unexplained weight loss, memory impairments, feeling inept to do even little tasks, losing of self-confidence. How will I bathe? How will I cook? How will I eat? And then in some severe cases of depression in the elderly, there is something called as the nihilistic delusion, wherein the conviction of nihilism is very strong. So they may start to believe that the world is about to come at an end, that they have nothing, that the entire world has burned down, that they have no money in their account, and they are so strongly convinced that everything revolves around this. So elderly depression, if it has to be managed, it has to be picked up early and treated early. How do we manage elderly depression? There are two ways, pharmacologically and non-pharmacologically. Not going much into the details, the fact is that today, in the huge armamentarium of the medications or psychotropics that we have, the new medications are pretty effective, less side effect prone for the elderly depression. As believed or as is prevalent in the general population that they are addictive, that one has to take them lifelong, the person just keeps sleeping the whole day, that's not true. The medication for elderly today are very specific and they bring about quick response. Hence, under a psychiatric supervision, starting medication early can definitely help from the symptoms becoming worse. Amongst the psychological or the psychosocial forms of intervention, mentioned, the first priority should be given to psychoeducating the family about the elderly depression. Most of the family members, or at least majority of them who come to us, ask us, why are they so depressed? They have nothing to do, they have no responsibilities, they just have to sit. We ask them, you sit and eat food and you eat TV all day, what is somebody saying to you? So, psychoeducating the family members about the nature of illness, the course, the common causes, the prognosis is very important. Psychoeducating or counseling the family members about dealing empathically with these patients, not using critical comments, hostile comments, not pushing them too hard, not overloading them with responsibilities, trying to engage them in family conversations, assigning them little small roles and responsibilities, asking the grandchildren to sit with the elderly and talk to them about their lives and how they have lived it, can go a long way in helping the individuals get better. Then again, there are specific forms of psychotherapy. Cognitive behavior therapy is a kind of psychotherapy which deals with individuals' cognitive biases, helps them learn behavioral techniques to manage their sleep, their appetite, their anxiety, their social conduct, and so on. Supportive psychotherapy is also there, which builds upon an individual's self-confidence, engages the family members in increasing the autonomy of the elderly and helping them move out little by little so that they feel more independent. There are other forms of psychotherapies too, and a combination of medication and psychotherapy works well for this age group and the elderly depression.